Okay, thank you. Well, again, I'd like to thank everyone for the opportunity to join with you today. And my topic for today is telemedicine, distance and near visual acuity tests for adults and children. And the purpose of this talk is to recognize the impact that COVID has had on all of our practices and the necessity for us to have adopted new manners of testing vision, and to recognize the fact that the most fundamental ocular sign, the most fundamental sign of ocular health or vital sign is visual acuity. So with that, let's see what kind of tools are available for us to measure visual acuity by telemedicine. First, I did a search in the Apple Store and found that there were 10 apps that were listed under the search for visual acuity test. And honestly, I didn't recognize any of them. And this was confirmed to the next step when I went to the Google Play Store and found 249 results under the search term visual acuity test. Most of these apps had some attempt to measure acuity, and most of them appeared to present with a simple scanned JPEG of a Rosenbaum near card, although there were some serious efforts to be found. One of the less serious efforts that I thought was just fun to read about was a test called How to Improve Eyesight. The company that presents it is called The Almighty Dollar, and it presented the kinds of information that you would find under Quora's response to how do I get better vision. Suggestions such as warm your eyes by palming, rolling your eyes, focus on a pen doing pencil push-ups and equivalent, massaging your temples, and my favorite, take a mini nap, were listed under exercises to improve vision under the search term visual acuity testing. So our department needed a visual acuity test, and I didn't think we were going to get anywhere with this one. And I came to the conclusion very quickly that if you go to the App Store, you may find something if you're technically savvy and if you wish to direct your own healthcare, but it does not necessarily represent a solution for physician-directed care. I concluded that apps in general are iffy, but specifically there are several that are listed that are appropriate for screening if an individual wishes under their own direction to monitor for change in vision or for simply exploring information about vision. But they're not appropriate for individuals with lower technical competency, individuals who have lower access to quality hardware, and most importantly, for use by us as clinical decision makers, unless they have been previously validated. I talk about two resources that I did find online that have been published since the start of the COVID epidemic, and which I think represent real efforts in order to improve online measurement using resources that can be downloaded or obtained by patients. The first I'd like to mention is the Go Check Kids digital visual acuity test app. Most of us know Go Check Kids for the photo screener that they have developed based on the iPhone, but this is a visual acuity test that is reminiscent of the ATS HOTV protocol. It's an iPhone app, and what is happening with this is that within the app, a line of randomized order H, O, T, and V is presented on the top of the app display, and then underneath it is a scaling smaller progressively one of four letters. So the task of the child is to look at the lower, in this instance, T, and find where it matches on the top line. And the way the match is identified is through the child indicating by pointing whether the T that they're looking to match with is to the left or to the right. So they would point to the left or to the right, and then the operator would do something along the lines of a tip. you can see that the letter H, that the letters that they're being tested are getting progressively smaller. And so it's harder for the child to see where to match. That's a very clever application. Again, it's not the HOTV protocol, it's an ATS-like protocol. And it's a protocol that is intended for use specifically with the iPhone. And it has pretty good results. Dr. Silverstein did an evaluation of this with 53 children. And while there were significant differences at the statistical level, the differences may be statistically significant, but less clinically significant. I draw your attention to this line down here that says the percentage of eyes with visual acuity measured by GoCheckKid within one line of the HOTV ATS and chart acuities were 65% and 86% respectively. That's a pretty good, that's about as good as most visual acuity tests agree with each other within a line. Within 7 letters is the standard of statistics. So the conclusion that was produced by this test was that this GoCheckKids Act, if used properly at a distance of 5 feet, provided modest correlation of visual acuity compared to the chart and fair correlation with the HOTV study within one line. That's pretty good. And that was in American Journal of Ophthalmology in this year. Another test that has become available online that you might have read about in journal JAMA was the Moorfields eye test, which uses a rather different approach to visual acuity testing. This is intended for a close cooperation with a tester at the other end who, someone goes online, they go to this website, homeacuitytest.org, and they request a printed eye chart, and one of 58 quadrillion unique charts will be printed for them. That's a tremendous number. It's not an ETDRS chart. The chart is a half octave, meaning every other line doubles in size. And instead of 5 letters per line, there's only 4 letters per line. But what will happen is that at a distance of 5 feet, a score sheet will be filled out by a helper, and then Moorfields will be talked with on the telephone for the right eye and the left eye score. And they interpolate these 18 symbols to an HOTV or an ETDRS acuity. And again, it was evaluated. And the evaluation, again, coincidentally, was of 50 patient subjects of controls and 100 ophthalmology patients. And the take home here is that there was good agreement in visual acuity for the ophthalmology patients, that a one-line difference occurred on average, and that the logmar, one line on a logmar chart is 0.1. The range was pretty typical of several lines, but with an average of 1 line difference. So 2 options that are available, one an app, one a printable, somewhat unusual and requiring operator intervention in real time printed test. I'd like to describe work that we have developed here at the University of Arizona to try and address this problem as well. And it's available through the Journal of APOS. It was published in August of 2020. And it's telemedicine distance and near visual acuity tests for adults and children. I'd like to acknowledge my co-authors, Kevin Jang, Divya Ramesh, Dr. Marshall, Selene Yeskis, and Dr. Harvey. So what we were looking for was early in the pandemic to develop a home-based acuity measurement that was available to all of our patients, not just the most technologically savvy. And we proposed to distribute eye charts and instructions, as well as an Amsler grid and near cards, as either PDF files for printing or JPEGs for electronic presentation, with the idea that a patient would be scheduled for an appointment and we would email these documents to them. We recognize that most homes don't have 10-foot lanes and that the rooms need to be shorter, so we developed it for a test distance of 1.5 or 3 meters and implemented the ETDRS R chart, the refraction chart, for adults, and a similarly designed HOTV chart in ETDRS format with a matching card for children, and designed it for an optimal test distance of 1.5 meters, which corresponds to English 2200 to 2016 or metric 640 to 64.75. Now, calibration is always an issue for these. And so at the bottom of the chart in the corner is a 25 millimeter diameter image of our US quarter, or incidentally, the same diameter as your 2 rupee coin, 25 millimeters. So the idea is that if the chart is printed out properly or displayed properly, this image of the coin will match the real size of the coin. So you have to find a coin and check the size of the chart to make sure it's properly scaled. Now, if you've got an email, perhaps you got it at an internet cafe, then you would use the printer of the internet cafe and print out the charts along with the instructions. A matching card is shown here, along with the HOTV Logmar format. And then you would take it and lay it down after it was on the printer and confirm that the calibration is correct. On the other hand, if you have a tablet computer, a laptop computer, or a computer with a display at home, and you can get 5 feet away from that device, then it's easier to email a JPEG image of the HOTV chart itself. It seemed to us that at this point, everybody knows how to look at a picture on their iPhone or their mobile device. So we just mail them what we describe as a picture and ask them to find a friend to help them have their Acuity test performed. And here's an example of opening an email, seeing the picture, and then recognizing the fact that the image is of incorrect size. So pinching to zoom until it's of the right size, and then removing the coin and scrolling the display back and forth at a distance of 5 feet, pointing out the letters one at a time and measuring which last line is the one that the patient recognized 3 out of 5 symbols correctly. So this is a format that's familiar both to us as clinicians and a format that is operable by most patients, we found. Does it work? Well, it was validated by a team from Vanderbilt University. We were very happy to find that they took advantage of this test and performed a very detailed analysis. What they did was contacted 200 patients in advance before coming into the clinic and had them test their vision at home and bring their results with them, and then have the test repeated in person. And the results there, the mean visual acuity score was 4.1 letters different between our chart, the ETDRS chart, well within the 7-letter equivalence margin. And the conclusion of this group was that the ETDRS visual acuity test self-administered following this standardized protocol was equivalent to a standardized technician-administered visual acuity test performed by the clinic. And this is a Bland-Altman plot showing the pattern of the deviation. This is difference versus mean plot. The closer those circles are to the black line, the closer there was to agreement. And the larger the diameter of circle, the more samples there were in that. Patients' acceptance of this format test was very high. 98% of the patients agreed or strongly agreed that the Acuity test was easy to set up and perform, and 94% said that they would be willing to perform the test at home. They also felt that the barriers to preventing them were low, and less than 5% of patients felt that the technological barriers were insurmountable for them. So in conclusion, I come to the conclusion that it is possible to measure visual acuity, the most basic ocular vital sign, from home for telemedicine care using validated methods. These methods include apps, electronic displays, and printed charts. Some methods are simpler than others. Some are approachable by download by the patient for their own administration. Others are sent to them by our direction under email. And I just would like to encourage everyone to think about this as, when it comes to technology, we have a tendency to think of applying technology from the hands that we have ourselves, from our own skill set. it's important to show some empathy and think about where the other person is coming from and try and meet them where they are, not where we are. Because you have to remember that not every cell phone comes with a granddaughter that shows you how to use it. With that, I'd like to say thank you and wish you all well with your surge of COVID and your recovery. It was horrendous here in Arizona. We wish you the best and our prayers are with you.
Thank you so much.